All right, I'm talking to Simon Lewis of Elevate Health, and you were just talking to me a few seconds ago about lifestyle illnesses. Can you tell me what that's about?
So if you look at the largest causes of global healthcare costs today, they come from what we call lifestyle illnesses. So they're also known as chronic non-communicable diseases. So non-communicable in terms of you don't catch them. So whereas years ago we would die because we caught airborne illnesses or waterborne illnesses, now largely people are dying because of the lifestyle choices they make. So that would be eating too much, eating the wrong types of highly calorific foods, not exercising enough, smoking, drinking and using drugs. So those issues together contribute to what they call lifestyle illnesses, which would be stroke, diabetes, heart disease, lung cancers, or upper respiratory disorders. So those are not only the largest causes of death, they make up the 6 of the 10 largest causes of death today, but they're also the biggest drivers of healthcare costs.
All right, that's a fairly frightening thought. So what's actually your solution to it?
So if you look at up to date how healthcare has been trying to deal with this, it's been looking at treating the actual issues after they've happened. A lot more research and thought is now going into what they call preventative medicine. So the Elevate Health platform is a reward platform that enables an insurance company, a government, a health authority or an employer to reward its citizens, its policyholders, its employees for achieving a set of lifestyle changes. So that could be stopping smoking, losing weight, eating healthier foods, taking their medications on time, because these will all have huge effects in terms of reducing healthcare costs, but also increasing productivity.
And you're using a kind of a blockchain/token-based system to do this?
We are, but that's largely because of the payment mechanism. So if you're asking somebody to achieve a change in their behavior, then the reward that they have to receive for doing that has to be in time with the behavioral change. So if you're rewarding somebody to stop smoking, for example, if you had 2 choices, the first choice would be, okay, if you stop smoking and we're going to give you $200 at the end of the month, the brain wouldn't really see that as a tangible reward because it's so far away. But if you rewarded a smoker 2 or 3 times a day for stopping smoking, very small amounts, it's going to be far more tangible to the brain. So we're really using the blockchain technology as a payment mechanism to automate and facilitate, hundreds and millions of payments per day without any human interaction.
Okay, so you're talking about rewarding people for good behavior. How is that actually monitored and tracked?
How do we monitor those lifestyle changes? Through a wide raft of mHealth technologies. So one of the things that has really developed over the past 5 years has been the way that we can measure lifestyle changes through our phones and through smart applications. So there are now cellular devices that you can show if you've been smoking, if you've been drinking, and this is something that is advancing very, very quickly. There's a lot of work coming out now that's going to be measuring your sweat secretions. So just simply from the secretion of your sweat, you'll be able to monitor and look at a wide range of lifestyle and healthcare metrics.
I got to admit, a small part of me shudders to think where all that could lead in the future. Like, how easily would it be to go from rewarding people for good behavior to just like punishing them for bad behavior?
Well, I don't think it's too far away, and I mean, indeed, a lot of the social punishment that's happening with China now, where they're giving you a social credit score, that is already happening. I think rewarding people for good behavior is certainly a good thing. But whether other people are rewarding people for bad behavior, I don't think that's anything that we can stop. But we can just do the opposite and perform, good things.
Yeah, I wasn't thinking so much of rewarding them for bad behavior, although that's an interesting idea. I was thinking more one day if the system becomes so widespread, you might be disadvantaged by not joining it.
Yeah, well, I do think that, particularly governments are, looking for ways to save healthcare costs. The NHS in the UK, for example, they spend more on diabetes type 2 than they do on the police service, the fire service, and the judiciary service combined. So, they are being forced to look into solutions that are different. So, if they don't find solutions that are going to work, then the healthcare costs are going to become so unmanageable that they might have to look at I guess, more draconian measures. But our thinking certainly is that there's still a lot of preventative things that you can do before you have to look at more draconian solutions.
Right, and actually, what blockchain platform are you based on?
We're actually building on RSK, on the RSK smart contract platform. So we're going to be one of the first companies to be building upon their blockchain. What we like about it is, Ethereum has been around for, a number of years now. And we think building on the RSK blockchain will be a little bit different. And also you have the immutability of the Bitcoin ledger built into that. So we're working pretty closely with RSK.
Oh, excellent. Yeah, we've always found RSK to be a pretty promising project. So what stage are you at? Are you close to launch?
We were looking to launch Q1 of next year. So right now we're just basically making sure that we have a number of applications, pilot projects in process. So once they're complete, we'll be looking to launch, I'd say Q1 2019.
Excellent. All right then. Well, if anyone wants to find out more about it, where should they go?
You can go to our Twitter, our Telegram, or our website. The website is elevatehealth.io.
All right. Thanks a lot, Simon. Nice to meet you.
Thank you very much, John. Cheers.